All right, lots of people are getting sick. It seems like it's in full swing. Cases of the flu, RSV, the norovirus have all been widely reported. The CDC says that the flu virus is trending higher than the other germs, with emergency room visits very, very high. Joining us now with what to look for, what you can do to try to protect yourself, Dr. Susannah Hills, ENT surgeon and assistant professor at Columbia University Medical Center. Nice to have you back here, Doc.
My pleasure.
So what are you seeing right now?
Yeah, well, it looks like cases of the flu have really picked up this month. So we're seeing a real increase in influenza. RSV levels have been high for several weeks, and we expect at this time of year all of these viruses pick up. Why? Because we just had the holiday season. It's cold outside. People have been indoors. There's been a lot of contact.
So I hear the emergency rooms at hospitals across the city are pretty packed. Are people using them because it's an emergency, or they're using it as a doctor?
Both. And really, I would encourage everybody to go to their primary care doctor, to get in touch with their family doctor, so they're available to them. And when they get sick with these illnesses, with the flu or a cold or a bug, try to see your primary care doctor first. You will wait less time, and it really relieves our emergency rooms, which become packed this time of year.
Right. And you need them for an emergency.
That's right.
Okay, let's start with the flu. At what point should you go to the emergency, or should you go to the emergency at all if you really feel badly with the flu?
Yeah, great question, Rosanna. And this holds true for really any virus. If you're not able to keep fluids down, there's a risk of dehydration. That can be really dangerous. So that's a reason to go to the emergency room. If you're taking Tylenol, Motrin, and you have a really high fever that's not responding to that and not coming down, that's also a reason to consider going to the hospital.
How many days should you be concerned with having a high fever?
Yeah, so I'd say a fever over 102 that's not responding to Tylenol for even 24 hours, 48 hours, you should see a doctor or go to the emergency room if you really can't control it.
Got it. What's the difference between the flu and RSV?
So they're different viral strains. The flu, millions and millions of people get the flu every year across the globe. In this country, millions get the flu. Fewer people get RSV, although it's very common. The thing that I get concerned about with RSV is the intense damage it causes to the airway. Little children and older adults, the elderly, can get very sick with RSV, with airway complications, and end up in the hospital pretty quickly.
So is that like having problems breathing?
Right. Right. And the flu can cause that too, but the RSV does cause really severe damage. So either can cause breathing trouble. I get really worried about RSV.
Got it. A lot of people in my family have the norovirus. That's pretty contagious, right?
It's so contagious. Yeah,
but it's not airborne.
No, it's by contact, hand to mouth, and it's a really tough virus. It has a hard shell. It's hard to kill. It doesn't respond to alcohol-based hand sanitizers or wipes. So the key with the norovirus, if you think it's going through your home or you've been in contact, you've got to start washing your hands with soap and water, and be really careful about cleaning surfaces and what you put on your hands and on your mouth.
Interesting that those antibiotics don't work on your,
the hand sanitizer, alcohol-based, not for norovirus. They work great for the other ones, but not for norovirus.
So wash your hands with old-fashioned soap and water. What's this new virus that is from China, HMPV?
Yeah.
Should we be concerned about it?
Yeah, well, I'm glad you're pointing that out. There have been headlines about it. The truth is HMPV, or metapneumovirus, has been around for decades. I see it every year, quite frequently here. And there was some question about whether case numbers were going up in China. The CDC and World Health Organization numbers seem to suggest that case numbers are actually what they have been in China. So there's no evidence right now that we see for a spike or an increased number of cases. And there's not a new virus going around that we need to be especially worried about.
Anything we can take to keep ourselves protected from all this crud that's going on around us?
Right. So getting good rest is so important. Taking a
sleep, right?
So important.
Sleep.
Yeah. Multivitamins, eating a good diet, good nutrition, so important. And then, of course, for those who are interested, vaccines are available for some of these illnesses too. There's a flu vaccine, COVID vaccine, there's an RSV vaccine for some people. So there are some options for that too.
So still, I took my flu vaccine back in October. Still time to take the flu vaccine?
Yes, yeah, the season goes through April.
Oh, it does?
So, yes, and it works within a couple of weeks. So
because somebody
absolutely.
said that we were already at like the height of the flu season. Is that true? Or
well, we're seeing it pick up right now, and I think cases will be high for weeks to come. And the season lasts for months, so into the spring.
Gotcha.
So you can still get a good benefit.
Okay, Dr. Susannah Hills, how can people find you?
Susannah Hills, I'm at Columbia, drsus.com.
All right.
Yep.
Thank you so much. Have
You
a
bet.
great day. Stay safe and healthy.